Good morning and happy Friday, everyone. Thank you so much for joining the next installment in Advocates for Ohio's Future budget webinar series. Today, we are excited to focus on the education budget, really focusing on K through 12 here, opportunities, successes, and threats. We know we are only really a third of the way through this budget, chugging along through committee hearings in the Senate. There are a number of standing committee hearings on the budget this past week. We just got word that Senate Finance will meet as a full committee next week on Tuesday and Thursday with a bit of focused hearings on a couple different issue-specific days. So I believe Tuesday is workforce and education, I think. And then on Thursday, we have a number of other issue area focuses. We can put those in the chat as well. But wanted to remind folks that that amendment deadline is coming up this coming Wednesday in the Senate. So if you have been communicating with an elected official, a member of the Senate, to submit an amendment, or if you're getting something drafted, someone's getting something drafted for you, make sure that you follow up and make sure that that process is moving along, because there will be a limited amount of time next week to get those submitted by your chosen sponsor. And then after that, we will wait about a week before we see that sub bill in the Senate, and then a second round of amendments for that omnibus. So we are in that time period where things move fairly quickly. So we are excited that you are here along on the ride for us. Apologize if I did not introduce myself as we started. My name is Kelsey Bergfeld. I'm the Director of Advocates for Ohio's Future. I'm joined by my policy associate, Sarah Hudasek, is behind the scenes moving things along with us today. And we are excited to join three of our member organizations to talk about really their expertise in the budget and their experience so far, what they're seeing, what they think is good, what is maybe not so good, and some certainly opportunities to engage in the next few weeks. So without further ado, I'm going to introduce AOF co-chair and the great Darold Johnson with the Ohio Federation of Teachers. Darold, whenever you're ready, please go ahead and take it away.
Thank you. And great is a prerequisite for me speaking to any group. So thank you for getting the notice on.
Of course, happy to. Happy to. Take it away, Darold. Thanks.
We're happy to talk about the House version of the budget so far. When we're looking at this, we go to the school funding slide next in this process. And basically, the way it looks like in the House, we have a fair school funding formula that was put in to the last part of the last biennium budget. It got us about a third of the way there. This version of the fair school funding formula gets us 2/3 of the way there in terms of full implementation. And it does, has $1 billion increase in there for K to 12 funding, 497 million in FY24 and FY25. We have 607 million increase. So we're looking at 8 billion and 8.2 billion in over the biennium for K-12. We look at higher career tech, and looking at the funding for career tech, they have a 9.4% increase. That's a significant increase because they have not received much of an increase over the last couple of years. The first 4 years of the governor's budgets, which 2 of them, they significantly lagged behind in terms of what their needs were. Since we're going to talk about student wellness and success, I'll just have a brief slide on that, just to say what the budget says about this. Because the fair school funding formula sort of has different components. The student wellness and success is one of the components in the formula, and the House and the governor may put in language that says, districts are, required to spend 50% of their student wellness and success programs for either physical or mental health initiatives or a combination of both. They can connect with a community mental health provider, or they could use the monies to connect with a community partner identified in the law related to DPIA. One of the provisions in DPIA is a resource coordinator can be used to coordinate human services at school district levels. We led the fight to get community learning centers up and running in the state legislatively. And so we've been following that process. And so that part of the money could be used for that extension as well. So it also we'll save the rest of that for our next presenter, who will talk. Zach will talk more about that in full speed, so I won't go into that. But we're talking about increasing the teaching pool and student literacy. Grow Your Own Teaching Program is a bill that Representative Lightbody had in the last General Assembly and in this General Assembly, and it was folded into the budget. This is a program that would give scholarships up to $7,500 for those who are committed to work and teach in at least 4 years after graduating at a high school. So that is one of the things that is very important to grow this program, get new teachers on the ground. But we'll talk more about how teachers are feeling about the teaching profession a little later. You might heard of the effort around science of reading. The governor has proposed this new literacy program. He talked about $64 million over the biennium. The House reduced that a little bit, $44 million for curricula, $21 million over the next 2 years in the biennium that was the governor's proposal. They reduced it to $6 million over the biennium. So basically, science of reading, which I find hilarious that Republicans want to talk about science and reading, but not science and vaccination. But anyway, I digress. So the science of reading is a program that allows for more phonics in terms of reading. The bill also bans 3Qing method, which is a method that helps you identify words and connections and pictures and sentence structure. We feel that banning of 3Qing is something that we oppose. When Mississippi, of course, we want to be like some southern states, and Mississippi has instituted the science of reading. When Mississippi instituted it, they did not ban 3Qing. Other states have not banned 3Qing, and we think a literacy teacher, a teacher who's going to focus on learning, particularly in the early grades, needs to have multiple methods to structure differentiated learning for their students so that it can meet their needs. Next slide. So I just put this in here because I found it interesting. We all heard College Credit Plus. This is supposed to way Governor Kasich came up with to help kids get an early start on college and reduce their cost of college. Now the House has looked at policy and said that we want to broaden the scope so that we focus on in-demand jobs. And so they see in-demand jobs as engineering, technology, nursing, teaching, social and behavioral or mental health professions, law enforcement. And basically, this is going to be developed with the chancellor and the Workforce Transformation Office developing the list of demand jobs. I think that we want to look at College Credit Plus. We want to look at career tech. We want to give this variety of experiences to every student, and we will make sure every student gets the opportunity to move forward. But we also don't want to make education just career focused. It should be flexible enough so fine arts and music and languages and all these other kind of programs should be explored as well. So we have well-rounded individuals in our state to move ahead. Next slide. So when you look at teacher salary, there's two things. The budget increases the minimum teaching salary from $30,000 to $40,000. That's almost 17,000 teachers would benefit from this plan. We see that They have the ability to start off early with their careers. But one of the things that we are very concerned about is not only the new teachers coming on, but we're also concerned about mid-career and how do we keep those teachers in school teaching and helping students. But we've seen this in other places whereby Republican-controlled states such as Texas, Mississippi, and Florida have increased their teacher salary because of teacher shortages. And that still hasn't worked because when you start banning books, blaming teachers, have, school discipline issues, et cetera, you don't make this profession as attractive as it once was. So it's great to see how that 40,000, how that increased to 40,000, but we still think we need to look all across the continuum, make sure we keep teachers in the classroom. Next slide. So Senator Hoagland has a bill that would say that anyone who has been in the military should be able to become a teacher and should be able to become a teacher without having any additional college credits required. Now, we have an alternative license program. We have from a program that recruits and promotes and gives military troops to teachers program that's been around for several years. But this alternative in the budget is proposed by the governor to try to, again, fill the gap of the teacher shortage. It's in a program that would incentivize local school districts to hire folks with military background, and it would give them additional financial support to do so. Next slide. So school vouchers have been very big. It's one of the issues that we have been fighting for years. And this year, we've had two bills, House Bill 11 and Senate Bill 11. Both are voucher expansion programs that would create a universal voucher program. The House bill increases the voucher program from 250% of poverty to 450% of poverty. Previously, it was 300% of poverty was the cap. We're hearing that Matt Hoffman, the Senate president, would like to get rid of that cap and just make it universal overall. But as you can see, the increased amount for just the Ed Choice Scholarship is like $782 million in 24 and $851 million in 25. The fiscal note for House Bill 11 was like $1.13 billion. These numbers more accurately reflect what was in Senate Bill 11. We think this is just a drain of monies from traditional public schools. And we see the next language, the next bullet as a way to justify this whole universal program piece, which is to say they want the Department of Education to create a data performance base to look at how religious schools are doing versus traditional public schools. And so if most of these our viewers here are from Central Ohio, we have on Broad Street, we have the State House, but further down on Broad Street, we have East High, and just maybe half a mile further on Broad Street, we have St. Charles. Now, St. Charles is a Catholic school. You can't look at and compare East High versus St. Charles because they draw two different types of populations. One, clearly, East High is predominantly African-American, low income. I would say that St. Charles is definitely a higher income, two-parent families there. And so obviously you don't have to do a data performance to tell me that St. Charles students are performing better than kids who are going to East High. Relatively, and I say relatively because we do have some great students who are going to East High, no question about it. But they're overcoming a lot more barriers and conditions in their lives than the kids at St. Charles. So we think this should measure apples to apples. We should only look at the voucher students who are going to these schools and compare them to traditional public schools. Because when this has happened in the past, in the early 2004 to 2006, a study was done of voucher students, and we found that the kids who attended public schools were doing better or just as well as the kids who were in private school. So when we do an apples to apples comparison, there isn't much difference in student performance. The John Peterson Voucher Program is a program that deals with kids who have disabilities and so or challenges. And so that program received a substantial increase to handle the different weights in that program. Next. So other bills that could be in the budget from the Senate could be Senate Bill 1. This is a bill that would change the Ohio Department of Education name and to the Department of Education and Workforce. It would make it an executive branch department, and it would also allow the governor to appoint a director and a deputy director for education, K-12, and a deputy director for workforce. In 1953, citizens of Ohio voted to take the Department of Education out of the executive branch and make it an independent agency. And now Senate Bill 1 would reverse the voices of the public and put it back into the executive branch without a public referendum on it. We are seriously concerned about what happens, as you can see in other states when the executive branch has control of the Department of Education. You get book bannings, you get curriculum changes, you get threats to teachers, you find schools being unsafe for students, and culture wars playing out in school, on the school grounds. So we're very concerned about that, and we seriously do oppose having Senate Bill 1 in that budget process or passing it all. Senate Bill 83 is a higher education bill. It touts itself as education reform for higher ed. And basically what this bill would do is change the operation of higher education. It takes away collective bargaining for unions that operate, for faculty members and unions that operate on college campuses. It determines how curriculum is taught and other changes that over 500 people submitted written testimony against. And there is a sub-bill that would be heard next week on this issue. Senator Hoffman said both of these bills are priorities for him, his caucus, so we'll be willing to follow that closely. Next slide. So I just wanted to share this information. We surveyed like 2,200 of our teachers to ask them about their experience and how they were feeling. And 64, almost 65% of them had a lower satisfaction in their job than they had just a few years ago. 72% had serious considered leaving their job, and 56% considered leaving education completely. Next slide. So the reason for leaving are, student behavior. Almost 85% said student behavior, lack of autonomy and respect. 80 was a factor for 80%. Mandates and directives from state policymakers, 76%. Too much emphasis on standardized testing, 74%. Work hours, meaning the lack of breaks, prep periods, spending time working outside of school hours, etc. That was 67%. And then technology, paperwork, and administrative work, 67%, rounded up. So when it comes to being in the classroom, it comes to teaching students, there's a lot of pressures on students, but there's also a lot of pressures on teachers. And this sort of gives you a summary of how our members are feeling. Yeah, so if they do pass this, I just answered this one question. If we do pass the science of reading, students who have an IEP, they receive a different lesson plan. Yes, if they have an IEP, they would receive a different lesson plan. And that's it for me. Kelsey, back to you.
Sure, Daryl, thank you so much. And I do have one question. You mentioned again the science of reading, that proposal, but I guess what would be the motivation behind the banning of a different reading method or learning technique? I know other states, you said, did not take this approach. I guess why would you say Ohio is going after the certain technique or method of learning?
Because the other method of learning focuses on phonics, and this doesn't. This focuses on words, whole words, and then there are things out there that are against whole word learning and focus on return to phonics, but Ohio seems to be the only state that wants to ban it. So that speaks to the more authoritarian nature of what's going on in Ohio right now.
Understood. Well, Daryl, thank you so much for your insight. And as always, if you have additional questions for Daryl, please feel free to enter them in the chat or in the Q&A. I appreciate your time, Daryl. And coming up next, excited to welcome Zach DeCamp. He is the State Program and Policy Director at the Mental Health and Addiction Advocacy Coalition. Zach, whenever you're ready, take it away.
Awesome. Thank you, Kelsey. As Kelsey said, my name is Zach DeCamp, State Program and Policy Director of Mental Health and Addiction Advocacy Coalition. I'm about 2 months into the role myself. So I just came from working at the legislature, if I can talk today. So I'm very excited to get to be here with you guys and to talk a little bit more about student wellness and success. So this slide, we're just going to do kind of a little bit of a high level overview. So what are they? I wish I kind of would have put flexible in quotations a little bit. But they're flexible spending dollars centered around meeting the needs of the whole child, which is the physical, social, emotional, and intellectual aspects of each child's well-being. So this is trying to look at the more holistic health model and saying that these funds are dedicated to the whole well-being of the child. And these funds, I will say too, just for example, these, as a background, I think these funds in the past have been kind of a point of contention where some schools were using them quite well. I think there were some concerns as well that other schools may not have been using them as well. But a lot of the guardrails that we'll talk about later on, I think they come from the response to that concern. So in which they do put up some more guardrails in the budget about how these funds can be spent and where they can go. But these are great, honestly. I know that even ODE put out a report last year, I believe it was, that with the first rounds of the student wellness and success funds, that about 80% went to planning mental health services for schools. So we love to see that we're finally getting some more resources into the schools and into the communities. The goal too with these is that we're also partnering with existing resources in the community rather than just trying to keep it at the school. So I know that several schools already contract with behavioral health professionals. These can be school psychologists. I know that some schools use the Certified Ohio Behavioral Analysts, and basically the goal of these funds is that we're making sure that each aspect is being hit rather than just saying one school nurse is kind of helping a child navigate their entire healthcare system. So the amount, kind of similar to how Darold said, is that it's part of the school funding formula. So that long stretch of how each dollar amount is calculated is going to be broken down there, but this is factored into those funds. And as well, I did want to point out too, that they are separate from the DPIA, the Disadvantaged Pupil Impact Aid. A lot of times they work very well in conjunction with each other. The DPIA is pretty specific in where the fundings can go, but the SWSF, it can kind of go to the to be a little bit more broad. And you'll see that as well with part of the guardrails is that it just says that at least 50% have to go to these things. It doesn't say that 100%. So it does allow for these schools to kind of respond to the needs of the individual students that they serve, and not just, for example, if a school is already doing well in one area, that they can kind of take advantage of the existing resources rather than just pouring more funding into it and or leaving dollars on the table. But these the funds themselves, though, they must, and you'll see as well on a later slide, kind of from the comp doc, these schools have to come up with a plan that gets approved as well as shared on their website of how these funds are going to be used to serve the community, and also kind of a planning as well of if there's leftover funds, or if ODE believes that they're not using them to their fullest, kind of that bringing on that partnership of the state and local to the community. But these funds, I know as well, right now, ODE and OMOS are making a big push. Darold had mentioned them in passing, but there's a big push right now for these student wellness coordinators. And what these coordinators would do is that this is their entire job, their entire role at the school is to kind of coordinate all of these resources together and focus on health and wellness of the students. So a lot of smaller schools and kind of underserved districts, this job is kind of filled by either an existing administrator or a staff member at the school. What ODE and OMOS is, what they're really hoping for is that this can be a standalone position where that the only job of this person is to coordinate all this, because it's a monumental task trying to make sure that each student is being fully taken care of and fully receiving all the care that they need. So that's why a lot of these funds, they are available and kind of specific because they're trying to urge schools to adopt this model. I believe it was with Miami University. I could be wrong on that, but they over the past year, they started to implement this program where they're wellness coordinator centered to put into schools. And so far they've had some great results. If anybody is interested in trying to see how your school can get involved to be one of these, I know it's still kind of in the early stages of implementation, but anytime afterwards, I'd love to share some of the resources. ODE and OMOS have been fantastic to work with and trying to get this going in schools, but this fund, like this funding source right now, is a great opportunity that schools kind of haven't had in a while. That's focused entirely on the health of the child. And you know, as we all know, a child who is healthy is a child who can effectively learn. But we can go ahead and head to the next slide. So I'll keep this one really brief because I know that Kelsey wanted me to talk about the impacts with the budget. The fantastic news compared to other areas of the budget is that the executive and the House version match up pretty much side by side. There's very little difference. I think there was a small increase in some areas, but overall it is the exact same. And if you go and flip to the next slide of the comp doc, actually, you'll see the list goes down the row. It's just same as the executive for the DPIAs as well as the student wellness and success funds. When we go through this, this isn't all of the requirements. There are a few more not listed on here. But you will see that it kind of does set up this system of accountability for the funding. I think to guarantee that, and just anecdotally, I know that some individuals have said that they've heard of schools using these funds inappropriately for example, like for their sports teams or for anything like that. Whether or not that's true, this does kind of create this system of accountability of working with community providers and working in conjunction with existing resources rather than misusing some of the funding. And also too, this is just guaranteeing and verifying that these dollars are going to the student rather than elsewhere. And then also too, we have to be accountable at the end of the day. I know that that's one of the biggest concerns of the legislature. Anytime we try to fight for more funding for anyone in our community or anyone in our schools, we always have to make sure that we are being good stewards of those dollars and that we are using them to the best of our abilities. One point that I did want to point out as well from this list is that it also, you'll see that it says that they developed the plan in coordination with prevention or provider or even the local Adams boards. One thing that we'll talk about later and the other considerations is that these community partners are already doing a lot in the space for the general population. And now with telehealth and with some of the expansion, or I guess tightening up now, of Medicaid, there are more resources than ever to help these students. And another thing that actually, we can leave it on this slide, but we'll start moving into some of the other considerations. Ohio Rise is now starting to really take effect. And while it did have several issues with its unveiling, it is starting to get to a better place, and it only gets better the more that we use it and report the issues with it. So Ohio Rise is a system for ages 0 through 20 to help coordinate the health, mostly behavioral health, but help coordinate the health of these Medicaid recipients. It is, so far, it's going all right with the unveiling. I know that that several of the Adams boards have shared their concerns with the system itself and making sure that the patients are actually getting the care that they need. But Ohio Rise is basically trying to work in conjunction with the wellness coordinators to navigate all the various resources that are out there. And I know that there's probably even some experts in Ohio Rise in attendance of this webinar, but just wanted to put that on everyone's radar that it is a resource, and they even have a training that you can do to refer a child to go through the program for Ohio Rise. It's, I think, 8-hour course, and anybody can do it. Especially, I believe their goal is to have somebody who, if they're not the wellness coordinator, but somebody on staff at these schools who can help navigate Ohio Rise. As well as I also wanted to point out with this considerations is that while the student wellness and success funding did not take any significant hits, which we're thrilled for, the behavioral health side did take quite a few cuts in the budget from the executive to the House version. The local Adams boards themselves, I know, took about $11 million a year loss, I believe, is what they're projecting. And then the state psychiatric hospitals also took a significant cut. And this is just to say that the student wellness and success funds are basically are designed to work in tandem with the community resources. So if the community resources end up lacking, then that's when we're kind of concerned about the efficacy of these funds as well. So we're thrilled that we can keep these dollars going, but outside of that, we are worried that if the other providers or if the other local entities start falling behind because of the lack of funding or lack of available dollars for them, that the student wellness funds are not going to be as effective or as significant as they could be. But outside of that, I did want to keep it fairly brief. I know I told Sarah I was worried I'd go too fast or too slow, but I do think I'll stop there. And but if anybody has any questions, I would love to answer them in the chat and be a great help.
Zach, thank you so much. We do have a number of questions in the Q&A. If you wouldn't mind taking a couple right now. Zach, in your opinion, do you know if schools feel like the wellness funding is sufficient to meet the requirements that you outlined? They seem great, but wondering if they are already strained or straining already school staff already in place, and if this is enough.
Yes. So as I had shared anecdotally, that I know that some had concerns that there weren't guardrails before. On the flip side, we had also heard of some schools believing that that tighter guardrails will limit what they can even do with the money. So while these, I believe that a lot of these concerns themselves, luckily, like I believe the 50%, for example, is a good way to create some wiggle room for the schools. I believe the goal for this is to try to get closer to, I know you had mentioned creating some strains on the existing staff. The goal is, I think, to try to push schools to go closer to that coordinator model. Whether or not I believe that's an effective model or not, I'm not quite sure. Truthfully, I know that so far they've had some great success stories, but I don't know if it's a great model for every single school, especially the smaller ones, if it makes sense to have an entire position dedicated to the coordinator role. But so far they've had great success with it. But I do know that those concerns exist of putting just additional strains and roles on the staff that are already working overtime and working double duty to try to put this on the table for them. If that kind of answers the question a little bit.
Fantastic. Thanks for sharing, Zach. One more. Are these funds intended to support individual students' needs or support overall student needs with bigger, kind of less targeted programming? Or maybe a little of both?
Yeah, so I do believe it is kind of a little bit of both. The goal is to create initiatives that would impact the health and well-being of the entire school itself. But with that, for example, they can take these initiatives that are designed for individual students, if that makes sense. For example, if there's a certain population that they feel is being underserved in the community, they can have an initiative within their school to address those individual specific students. But it is going to work in conjunction with Medicaid recipients already. Any kind of healthcare that the student already qualifies for outside, this will work in conjunction with, but not necessarily to fill in for, if that makes sense.
That makes sense. Zach, looks like Darold has something to add.
Hey, Darold.
Yeah, thanks. I just wanted to, at this point, because it answers that question, it is individual and holistic. The governor went down and looked at the models that they have down in Cincinnati for wraparound services. And so based on that model provides individual services, healthcare, mental health, dental, food and nutrition, tutoring, all these other programs that help students in the classroom and outside the classroom, and for the communities that they serve, the neighborhoods that they serve as well.
Yeah, and I think kind of jumping on that as well, a great example of why we need these wraparound services is if you look at school psychologists, for an example. School psychologists, there's kind of two different tiers. There's the ones that work in school, at school, during the school year. And then as well as there are the more independent kind of school psychologists where they function entirely separate from the school themselves, but they still work with the same population. While a lot of times a student may meet with one of them, there are situations in which they may lack care and kind of the transition between. So the wraparound services, for example, can help transition these students. They could be, this is just an example, they could be used to help transition for like the students who seek care during the school year at the school with school psychologists, and transition as well as say on summer break to this independent school psychologist to work with them to make sure that there's still a continuity of care and that that they aren't lacking in anything when they're not at school themselves.
Mm-hmm. Incredibly important. Zachary, thank you so much for your presentation and for answering our questions so far. If you could hang on, I'm sure there might be some more at the end. And I'm really excited to introduce our final speaker today, Jillian Russell. Thank you so much for joining us. She is the Hunger Advocacy Fellow for the Hunger Network in Ohio. Jillian, when you're ready, please share with us.
Yes, thank you so much, Kelsey. So I'm Jillian Russell. I am here today with Hunger Network in Ohio, but also in partnership with the Hunger Free Schools Coalition to kind of inform you on some of the things that we're working with. So the Hunger Free Schools Coalition is a passionate collective working to take hunger off the table. And it's committed to ensure that every student in Ohio has access to not only meals, but healthy school meals. So we're going to start with some food insecurity data for the United States as a whole. So in 2021, 13.5 million US households, or 13.5%, were food insecure at some time during the year. So this could have been once, this could have been for a couple of weeks, but it also could have been for the whole year. And we found that food insecurity was higher for households with children, and also rural households and Black, Latinx, and Native American households experienced disproportionately higher rates of food insecurity. So as you can see here, for most of the United States, they are either near the US average or above the US average. In Ohio, we are near the US average of 10.4%. We can now look closer into Ohio as they're in food insecurity rates. In Ohio, there are 1,624,180 food insecure people in Ohio. And that makes our rate at 13.9%. I'm going to give you a couple of seconds to kind of look at the Ohio map so you can find your county and try to see where the food insecurity rate is in that county. We can continue on to the next one. So there's also some estimated program eligibility among people experiencing the food insecurity in Ohio that we see. So households are eligible to receive free school meals when they are at 130% of the federal poverty level. So for a family of 4, this is an annual income of $36,075 or less. We can also see that households are eligible for reduced price meals when they're at 185% of the federal poverty level. And so you can see here, there's 37% that are above of other nutrition program thresholds. There's 12% that are between the 130 and 185% of the poverty level. And then we have 50% of people are below the SNAP threshold of 130% poverty. So how did we get here? So there's been many federal anti-hunger initiatives during the pandemic. So during the start of the pandemic, one of the things that the federal government initiated was for all kids to receive free meals during the school year of 2020. So this allowed for schools to serve free meals to all students from the spring of 2020 and then for the whole 2021 to 2022 school year. So these waivers were from the USDA to support access to school meals and support program operations for school and community sites. So this also offered the pandemic electronic benefits transfer, which provide the nutritional resources to families who have lost access to free or reduced price meals and or children care meals due to school and child care closures. And families also received money on new or existing EBT cards to help fill the meals gap. So during this school year of the spring of 2020 and also into the last school year, all kids were able to receive their meals. So that was totally paid for all lunch meals during that time. So this is the first school year since the pandemic that it has not been allowed. So what is the impact of hunger on health and learning? So to the right, you can see the white pages that the Children's Defense Fund has published. I will put that in the chat after my presentation so that you can see all the different statistics of Ohio. But we have found that hunger harms not only health, but also harms learning. So children and adolescents experiencing hunger we've seen that they have lower math scores and poorer grades and are more likely to be hyperactive or even absent and tardy. So we see that if children are not receiving food, they cannot learn as well as they should. So teens experiencing hunger are also more likely to have been suspended. And children with hunger are more likely to have repeated a grade, received special education services, received mental health counseling than children from low-income households that do not experience hunger. So we see that if a child is not being able to be fed, they're not able to learn. So full bellies do lead to full minds. School meals also support learning. So we have seen that school breakfast has been linked with fewer visits to the school nurse and positive impacts on mental health, including reductions in behavioral problems, anxiety, and depression. We also have seen that students who participate in school breakfast programs have had improved attendance, improved behavior, and improved academic performance and academic achievement, as well as decreased tardiness. And at community eligible provision schools where all students have access to free meals, multiple out-of-school suspension rates have decreased significantly. These are photos of some of the programs that we've been able to go and see, and just some of the happy faces of the fresh and free school meals that are also healthy. So in Ohio, on an average day, 201 students participated in school breakfast, and 727,251 students participated in school lunch during the 2020-2021 school year. But before the pandemic, we were also seeing that 1 in 4 children were eligible for the free or reduced price meals, but did not participate in school lunch. And we also saw that 1 in 2 children did not participate in school breakfast, even though they were eligible. So our takeaway from finding this is that when all students have access to free meals, more students participate in school meals. So if we have the stigma of them having to be labeled as free meals or reduced meals, they're less likely to actually take advantage of that, even though they are eligible for it. But if we give access to everyone, there's not that stigma and everybody is being fed. They also did a School Nutrition Association survey results, and the survey results from the SNA found that school meal program directors across the country, not just Ohio, but the whole country, reported that serving free meals to all students during the pandemic not only increased their access to food, it increased their equity and fueled a large decrease in unpaid meal debt. There also was a survey that went out to Ohio parents showing that they also want hunger-free schools for all. So 87% of Ohio parents with children within the school system agree that school meals should be provided at no cost to all students, regardless of their ability to pay. So parents even see that that all kids should have the equal opportunity to receive those free meals and that all students should be fed every day. So what are some of the state efforts that are being done to address child hunger? So there are also other states that have looked into the free school meals for all legislated. So there are 5 states that have already passed legislation on this, but there's also more coming. So Pennsylvania offered free breakfast to all students during the 2022-23 school year. And some states have also eliminated the copay for the reduced price meals, and other states have passed legislation to ban lunch shaming practices. So here's some of the momentum that is being built with the healthy school meals for all. So you can see here in the green states, they are currently either have already passed or are working to pass different legislative things for the healthy school meals. You can see that in the yellow, which is only a few states there, they already have policies in place for the 2022-23 school year and are working to pass more legislation. You can see in the orange, which is only 1 state here, that already has a policy in place for the 2022-23 and the 2023-24 school years. And then you can see there in the blue, solid, they already have permanent policy passed. And then there's also permanent policies passed with the striped ones for the 2023-2024 school year. So where are we now here in Ohio? What is the scope of the problem? We have found that there is a more and more of a mounting problem of school meal debt across Ohio. You can see here, for example, the Westerville City Schools, their total debt as of this school year was $40,000. So you see all of this increasing numbers of the school meal debt is there because children's parents are not able to afford the lunches, but also are not eligible for the meal programs. We also see that there's a lot of lunch shaming occurring in various districts around Ohio, which means less students are accessing the school meals, even if they are eligible. We also find that a lot of our nutrition providers and even cafeteria workers are using their own money to help students afford school meals. So they're seeing that children are not able to pay for their lunches and they are having to say no, and they receive a cheese sandwich. But the kids are not happy with that. It's not nutritional. So we're also seeing that even our school workers are wanting to help by paying for other students' meals. Some legislative activity that is going on right now. So the free schools, school meals for all legislative is asking for our lunches. It would cover $303.5 million is how much it would take to cover for our lunches. And our breakfast would be $60.4 million. In total, it would cost $363.9 million to help pay for free school meals for all. So the idea is it's cost to eliminate reduced priced category. So if we took all of the kids who were already in the reduced and made them free meals, it would cost $3.1 million. And then there also is an idea of trying to have a school lunch shaming legislative that's being drafted, but there's currently no cost analysis at the time. So there's also been a lot of testimony that has happened within the House. So there was testimony in front of the House Finance Subcommittee on Primary and Secondary Education. Testimony in front of the full Finance Committee happened. There's also been lots and lots of individual representative meetings through Hunger Network, through the Children's Defense Fund, and many other groups that are working for the health hunger-free schools for all. There's also been amendments that have been drafted and submitted, and they're waiting, which I think this has been passed or been found, but it's been through the House, and next step is the Senate. So feel free to visit the Hunger Free Schools Ohio .org for more ways to get involved, to find more resources and legislative acts that are being done through this. But you can also see all of our partners that are also fighting for this. So as you can see, there's so many people who are wanting to make sure all of our children are being fed. And so for more information, please look at their website.
Jillian, thank you so much for your presentation. And I know AOF and many, many, many of our partner organizations are here on this list. We are very happy to support this initiative. Incredibly vital. I know this was a priority proposal for leaders in Finance Committee in the House. Hopefully we can preserve and even make some more progress in the Senate. Could not imagine, especially our kids coming, just being hungry in school at this point. Should not be acceptable. Appreciate everything that you've done as part of the coalition as well. So I'm going to look here at our questions. We have a couple coming in for you, Jillian. So this is great. How do you think the Hunger Free Schools initiative will fare in the Senate budget? Do we think that there's hope?
I think there can be hope. I know I was talking with Representative Sweeney yesterday, and we were talking about how there was work that was done in the House budget, and they're hoping to continue that momentum. So our big thing with the Senate budget is, to keep at least the progress that we've already made, and if not, make more progress. But our big thing is that we're hoping that the Senate will at least keep the progress that the House had already made.
Excellent. Thank you, Jillian. So there was progress in the House. Can you talk specifically to what progress was made in the House? And can you talk a little bit more about the anti-lunch shaming bill?
So for what progress was made is they made, as I've read, they made the reduced meals, the kids that were already eligible for the reduced meals, those will be made into free meals. So as much as it's not free meals for all students, it's still that little jump, to meet halfway, that there are giving free meals to at least the kids who were already at the reduced lunch program. So that is one thing that they did do that. I do not know a whole lot about the anti-lunch shaming bill, but we'll get some more resources for that to send out.
Excellent, Jillian, appreciate it. Kudos on your presentation from one of our AOF members. Is free breakfast already in the budget? I don't think so, but Jill, could you confirm?
I do not believe it's in the budget at the moment. Where once again, the little strives are what we're really hoping for. There's a big ask for the free school meals, but the little steps, always make into a bigger thing eventually. So that's our big hope.
Jillian, thank you so much. And would just like to draw folks' attention to one of our partners at the Children's Hunger Alliance. It dropped a link to the introduction of the Universal Schools Meals Act of 2023 from Congress just released that legislation. So that's fantastic. Looks like there's initiatives again on both the federal and state level here in Ohio to make sure our kids are fed and they can learn, they're ready to learn. So we have another question for all of our attendees here, for our excellent panelists this afternoon. How do we make sure that different aspects of the education budget don't get pitted against each other for funding, and that all of the important student supports are funded and invested in? A fantastic question. We know that when budgets are tight, you're right, unfortunately, valuable and fantastic causes do get pitted against each other. How can we avoid it? By working together. Darold, looks like you're ready.
Oh, no, that's it. We avoid it by working together. I mean, you answered the question. I mean, that's because that is what's going to happen. I mean, it happens every budget cycle. Do we trade off the reduced meals for something else? Do we, get reduced emphasis on the fair school funding formula so we can expand vouchers? I mean, that's what this is all about. And it's about all of us working together, saying these are all priorities. In a state where they have $6 billion in reserves, we should be using that money to help meet the needs of every Ohioan and keep pushing that thing,
Exactly. Thank you, Darold. And that's why really, I know the work of AOF and other organizations come together to talk about priorities and, whisperings and strategies to make sure that all priorities are lifted. And again, that kind of adversarial strategy doesn't succeed, right? Zach or Jillian, any additional thoughts?
Yeah, sure. I guess to say with it too, that a lot of times, as long as all the IPs are working together on the background, that's kind of where the communication really needs to happen as well. Because if one individual starts to work really hard in an area, kind of as a lone gunner, then that's kind of when we kind of see a lot of the adverse reactions in the legislature, especially because we know that a lot of times the legislature is they're trying to do good. So whenever they do make a decision that ends up inadvertently harming the budget of another area, it's usually because they weren't presented all the facts ahead of time. So it's really our duty to make sure that organizations like AOF, for example, we're all on the same page going into our request with the legislature, that we're, having those conversations in the background, just to make sure that each area is met with, parity and proper conversations are held in the background rather than to the legislature itself.
Well said. Thank you so much, Zach. Another question in from the chat. Can student wellness and success funds be used for school meals? If a student is hungry, doesn't that affect mental health?
That is a good question. I honestly, I personally, I don't see why they would not be able to. I know that there are specifics in which that they have to meet with the 50%, but I do not see a situation in which they couldn't be used in conjunction with school meals. But I would say whoever asked the question, if you are part of a school system, I would verify with ODE beforehand. But I do not see that would be an issue in using some of those funds towards that. Should that be in which the school would like to use them.
So a lot of school districts have reached out to food banks and to other providers, like to do backpacks or give them snacks over the weekend. So there's different ways to do it. So, and I think that gets back to Zach's issues about how far these funds have been used to do other things, is because we haven't really provided adequate funding for K-12. And so they've had to stretch their dollars. And so when they get a few dollars over here in this pot, but they also had unmet needs in another area, they've used those dollars to meet unmet needs. So I think by moving ahead on the fair school funding formula, by providing reduced free meals to reduce eligible kids for lunch, those things always help.
Excellent, folks. Well, that will close us off this morning. I appreciate your time, and I want to thank our panelists one more time for volunteering their time and energy and efforts this morning, and for your continued advocacy efforts at the State House. It was a long week, and I want to thank you for being with us this Friday morning. Just a reminder for our participants, our entire webinar was recorded. We will be happy to send the slides and the full recording to everyone who registered by the end of the day. I know my associate Sarah gets those out very, very quickly. She's just a rock star in getting out that information. And we hope that you will continue to follow along with AOF. Again, we are excited to have such a variety of partners at our table, again, united in health and human services, and making sure that exactly all of our priorities are lifted, and that we can work together to make sure that we all succeed at the end for the better of Ohioans and families. So make sure that you follow along with us on social media at Advocates for OH, as well as we have lots of great information on our website, as well as we make sure that we house all of our past webinars and information there, as well as our testimony and everything else that's happening these days. So folks, we want to thank you again for joining in our latest installment of our budget webinar series. We'll be back in the next week or 2 weeks, maybe post Senate sub-bill, to tell you all the changes that happened in the Senate as this, I don't want to say that the process is wrapping up, because we still have a long way to go. But as we get closer and closer to the end, we will be right along with you. Folks, thanks again. Happy Friday. Have a great weekend and great rest of your day. Thanks for being here. Thanks again to our panelists. You did so well. Thank you.
Thank you.